Good evening, everyone. I'd like to welcome each and every one of you to our Tuesday, September 4th, 2018 meeting. At this time, I would like to ask Brother Hayes if he would to lead us in our invocation. And following that, Miss Olivia Barnes, one of our 4-H'ers. I hear she's been on the move this evening tonight and all. We appreciate her filling in the gap and coming here with us tonight. We thank you for that. We'll stand, please.
Mr. Webb,
I'm sorry.
praise, I would like, there's a lot of sick people in Blaine County, and I wish we would include all those people, also include, one of our counterpart elected officials, Barry Lewis on Board of Education. He's in critical condition in Chapel, so if you please pray for all those, I appreciate it.
And my mother-in-law too, if you would.
I would say this, we had an update before the meeting tonight on Barry. He's stable, but it's going to depend on the next few days. They're not able to operate right now, what his daddy said. So let's keep that in prayer, your mother-in-law. Let's bow our heads. Father, we thank you so very much that you are the God of Bladen County.
Yes.
You're the one that protects us and guides us and directs us in a holy and righteous manner.
Yes.
Lord, you have placed upon us righteousness as a gift. You've placed upon us the watch care of Bladen County. And Father, as other shepherds, these commissioners, and all the department heads and all the employees, Lord, we have a great responsibility to you to make the right decision, to lay down our indifferences across our county and pick up, Lord, that banner that you would carry, that harmony would be in our county. And Lord, the sick folks in our county, some waiting operations, some in the process of operations. Lord, some at death's door. God, all I ask you to do is have you willing and way and move that mighty hand that you move so often that gives favor to your people. God, every decision made here tonight, I ask that it be under your guidance. I ask for our chairman's mother-in-law, Lord. I ask for Mary Lewis. I ask for so many more that we prayed for earlier this morning, Lord. That your protective hand would be upon them, watch over them, Lord. Give them the very best that heaven holds. And Lord, we'll be thankful through eternity for what you do for us. In Christ Jesus' name we pray, and all of God's people. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Olivia. Thank you and all you do. Before we approve the consent items, I'd like to amend the agenda to include the closed session in accordance with NCGS 143-318-11A3, attorney-client privilege, following item 14, individual delegations wishing to address the commissioners. Can I get a
Motion to approve the consent items with the addition.
Got a motion by Mr. Peterson, got a second by Mr. Cogdill. Any other questions, concerns? All in favor say aye.
Aye.
Opposed? So moved. Thank you. I assume everyone is going over the consent items.
Motion to approve.
Got a motion
Second.
by Mr. Cogdill, got a second by Dr. Mungoing. Any questions or concerns? Any further discussion? All in favor say aye.
Aye.
Opposed? Thanks so much. Matter of interest to commission.
I got one, Mr. Chairman.
Yes, sir.
I like Mr. Martin, the county manager, he would update us and bring us up to speed on that money that we budgeted for, how to appropriate it, and what's the process on the recreation piece of it, that they appropriate, where we at, and what's the status of it.
Okay, there, thank you, Mr. Cottrell. Money is appropriated in a contingency line item, so, that can be used for whatever purpose the board determines appropriate. As far as the policy, that has been shared with the board. I guess at some point we need to, there hasn't been any action taken on it, so at some point in the future that needs to be revisited, and we can certainly do that at any time.
If you would, I'd appreciate you kind of schedule, if it determined
Oh,
time
yeah.
frame, revisit that.
I'll be glad to, thank you.
Anyone else?
Yeah, Mr. Chair.
Councilman Moore?
I think last month I talked to Mr. Martin about the concerns for a resident from Kelly and several from Carver Creek about the water sample from them.
We have been in contact with Representative Ladiner to help it. We want to ensure that the message that we share is appropriate for everyone. And so we have been in contact with folks with Diener, and they are going, their public PR folks are going to help us craft that message.
The message or test,
Oh, I thought you were asking about a message.
they don't know, but their concern was, they're really thinking that they get their water from the same source as New Hanover and Brunswick. But then they said, if of the air, the fact that it could be airborne, it could be anywhere. And so they too wanna know if any wells have been tested on their end. That hurt.
Yeah. No personal or private residential wells have been tested. So
I
I
think
know,
someone wanted
yeah,
that.
as you may recall, basically the approach has been to start near the vicinity of the Chemours facility and then
Right.
work out until you get to a point that they get below the threshold of concern or whatever, so.
And what are they? How far
I
have they
think
come?
5.5 miles, I think they've gone about 5 or 5.5 miles, is my
That's it?
understanding.
But is that mostly because of the air or water source?
That would be because of air, well, it shows up in the groundwater, but it's because it's emitted through the ventilation stacks and then seeps down onto the ground or comes down onto the ground and seeps into the water.
So we know it's
So-
nothing on this end of the county, what you're saying.
That's my understanding, and that's why we want Diener to help us craft that
Let
message.
me know.
I certainly
And
will.
if not, then I guess some of them are asking for, hasn't been tested around yet.
Yeah.
Kelly and Cox Creek.
The Mount Orb well, as far as the county well, is, if I'm not mistaken, is the furthest well down, toward the eastern part of the county it was tested, and it didn't have any.
But you know, we
levels in
still
it.
have people on private wells.
Oh, I know,
Yeah.
a good portion of the county,
Yeah.
yes, ma'am.
And let me add a comment to that too, Dr. Moore. First of all, I'd like to address this issue. I commend all the commissioners last week. We had sometimes 3 things that we needed to be at the same hour. So we had to make decisions on where we needed to go and who needed to go where and on. I think we all did a pretty good job of that. And I commend each and every one of them for that. Also, on the Gen X thing, just like the people that you're speaking of, we had another meeting here in Bladen County this past Thursday night. My suggestion with people with these concerns, please understand everybody, this is a state investigation. The state's calling the shots. We're not passive. We're sitting here, we don't have Warren Buffett's wallet to go out there and challenge the state and impede in a state investigation. We can ask questions just like you do, but we're allowing them the opportunity to do their job. And they're calling the shots, I guess, based on their knowledge, their experience, and the people that they're dealing with as far as the range where they're reaching out. There was a concern, and I think Mr. Martin, he and I chose, and Mr. Priest was at that meeting in Thursday night. And the biggest topic was that they had stopped the bottled water on their facility. That was the big complaint. Well, they're supplying water based upon the state's requirements to 140 and above. And they're doing that by home delivery. Well, the biggest complaint, some of them that were the bigger complainers, was getting home delivery and going out to the site and picking up. And the biggest complaints come from the ones that were still getting it, but didn't have access to getting more out of the facility. And I promised the folks, when I got up and spoke at the end, that Mr. Scott explained that he didn't feel like he was getting across to Chemours. Well, I called him the next morning and talked to the president, the CEO, and he said, Mr. Britt, there's some confusion and some misunderstanding. The reason we stopped it at the plant, there was a lot of people getting water that shouldn't have been getting water. But those that are getting water and getting home delivered, if they're getting 3 gallons and they need 20 gallons, our staff, Mr. Martin's office, them, has the phone number for the people to call and can dial that number and request the need that they have, and it will be home delivered, which is very fair, and, they were apologetic, but they want to comply and do what's right in that response, and I respect them for taking that stance. But my suggestion though on some of those folks is they need to come to the meeting, wouldn't you say, Mr. Martin, and approach the state about their concern and say, look, we need you to reach out. If they haven't already done so and tested themselves, I would think they've had to test some beyond to know where they stopped. And I don't know if they're mentioning that or not, I have no way of knowing
I
that.
guess information will do that.
But I would encourage them to go to the meetings and state their concern for their area.
I did.
But rest assured that we're on top of what we're allowed to do at this time. And, as far as I know, they're doing what they're told to do at this time. And, I heard a lot of things at this particular time, and I think Mr. Martin would agree. We heard the word coexist for the first time that I've heard some people now want it right, want any damage if it's been done, once the state deems if there is a problem and has been, because I still personally don't know. But they know, the powers to be and know, and once they make that determination, then we look forward to whatever that is to be corrected. And then if they don't do what they're supposed to do, then that's when we can stand up and see why it's not being done. But we need to let the process
Right.
proceed and go forward.
Still like the
Yes, sir.
information.
I got one other thing, I'd like to thank you about the appointment to the East Point Board. And what I would like to do is try and put in where I can do a report and get it back to each one of you guys with things that's going on. But right now I'm kind of new at it, and it's a learning curve up there with all that's going on. So once I get everything up to speed, I try to enlighten you guys and bring the necessary information where it's going and what's been appropriated, because I did not know they handled that kind of money. And one day they spending $7, $8 million appropriating that kind of money on a monthly, up to $70, maybe $80 million a day in a meeting. So it's a learning curve for me to see that kind of money being handled in one place. So once I get it all lined out, I give it back to you guys, let you know what's going on.
Thank you, Mr. Cody. Anybody, Mr. Beaver?
Craig, you're gonna have to give me an update, but I was kinda wondering where we were on the personnel policy. I don't want that thing to drop, I want us to be moving forward with that thing.
Yes, sir. Thank you, it's not.
Okay.
It's not been dropped, it's moving forward.
One other thing to bring everyone up, last Thursday, we had an opportunity, the governor came down and, to oversee and to be excited somewhat on finally getting some money or some relief money for some of the people that had the disasters from the storm. And at the same time, we had a good opportunity and ample time to show them what the college and the sheriff's department, as far as the driving school behind the old prison camp. And, I took the time, somehow or another, I got in the car with him and we got to have a good long ride. So we got to talk about everything that we had been talking about with the schools. Mr. Martin is working on some stuff, and, at this point, I tell you, I'm really excited. He addressed us to get the information, and he's for us, doing the right thing and proceeding, so he supports what we're trying to do. And we'll know more about that at our next meeting. So there was a lot of things happened last Thursday that was for the good of our county. And I'm sure a lot of y'all in some of your meetings, the same way. And I spent all day Friday in Charlotte. I had the opportunity to go up to be, with the president on Friday, and I got home, Friday night around 10 o'clock. And we had a productive day there. So there's a lot of things that's happening. We got a lot of concerns in our county when it comes to not only the water with Comores, the water at White Lake, our hog industry. So keep us in prayer. We're working hard to come to some closure, to get some understanding, to get the people to cooperate with us, and to just be real and fair. And So we need your support and prayers in that, but rest assured, we're working hard to try to stay on it as much as we can.
Let me piggyback on that. We, Mr. Clark, Mr. Campbell, and Charles Brown, and a bunch of us, met with, Senator Raven and Gerald Brett there was from Rawson County. And, we presented him with the drawings and stuff, and he seemed very favorable to trying to help us after the election.
Anyone else?
That's on the facility out there, right?
Driving pad.
At this time, special recognition to one of our retirees, Mr. Tony Sessom. Did you have things all the commissioner come back? Tony, I apologize for a lot of the questions that we had to miss your function Friday, but so much stuff going on.
I understand.
After what you just heard, you probably understand why.
I'm just a minuscule part of this. More important stuff besides me.
And grateful appreciation to Tony Sessom for dedicated service to the people of Bladen County as Lieutenant Tony E. Sessom, presented by the Bladen County Board of Commissioners, given this 4th day of September, year of service, May 1990 to August 2018. I don't know how to thank you for all the years of service, and not just what you've done for us, but the person you are and the way you represent this county in every respect. So,
I appreciate it. It's been a pleasure. Thanks, sir. Speech now.
Come on, Tony.
I got ridiculed for mowing Friday. It was a little too long. So.
individual delegation wish to address the commissioners. Cape Fear Resource Conservation and Development, Danella D'Arcangelo, the Executive Director, along with our Director right here.
Thank you. This is, like I say, Danielle D'Arcangelo. He's our Executive Director with Cape Fear Resource Conservation and Development. And we come to you tonight to talk about a project with you that we've partnered with several other entities, and it's a aquatic, what's it called?
Aquatic activity.
Yes, well, aquatic connectivity project. So Daniel's going to just give you a brief overview of the project and some of the our future steps that we're going to take to have this project implemented.
Good evening, and thank you for having us again. I really appreciate that. We did review this project with you before, but I'd just like to get you up to date as far as where we're at and what we're doing, so that you feel like you've got all the information, and you're welcome to ask questions as well if you feel like there's something I've left out. We're working with Moffitt and Nickel, as well as the Southeast Aquatics Resource Partnership. We're looking at assessing, ranking, and prioritizing 200 culverts that lead to the Black River. And what we're doing with those particular culverts is we're looking to see what culverts need restoration or replacement. And we'd like to rank the top 5, looking at them for feasibility, also looking at them with DOT and determining whether or not these are the best culverts to address, and whether or not these are going to actually improve the flow for flooding, for fish passage, and for general use of the waterway system. So where we're at right now is that we've gotten our letters of support from Bladen and Pender County, so we thank you for that. We've done our educational presentations, which is what happened when I came previously to talk to you. We've engaged with DOT as well as some other stakeholders to determine a list of priority culverts. We've done a preliminary desktop analysis of the roads and the stream crossings, and we have done planning for the public meetings through many stakeholders. So that's what we've done. At this point, We are working with the county, DOT, and our teams within our group in terms of who's actually gonna be doing the culvert assessment, myself, Moffett and Nickel Engineers, SARP, those stakeholders to determine priority areas. We are actually gonna be hosting 2 meetings to inform residents, public officials, businesses, give people the opportunity to discuss what's going on in their area, if there's any feedback that we need, and provide them with information in terms of maps and where we're looking so that we can get feedback for that, those particular culverts. We are looking to do that, I believe, on the 27th of this coming month, or this month now, or September. And so we're gonna be doing that in both Bladen and Pender County. So if you have any input on that, we're happy to hear about that. We're also gonna be doing the site assessment in October and November, and the barrier prioritization and ranking is set for November and December. So I just wanted to sort of give you that overview as far as what we're doing, where we're at, what we've done so far, and where we're going, and just give you sort of that opportunity to ask any questions or concerns or anything of that nature.
But by working on these covers, would that create a floodplain zone where it would raise it like a 100-year floodplain, or is it gonna decrease the amount of?
We are looking at those particular culverts to ensure that the passability is the way it should be, as if the culvert wasn't there. So in terms of just making the culvert less likely to impede the waterways, that's what we're looking at.
So it would be an effect on insurance rates and those type of things in that area?
Well, hopefully there would be, if any effect, there'd be a positive effect. So yes, that's under consideration.
The location of your September 27th meeting, location?
Where is the location?
It's gonna be at the agriculture building. I'm not sure exactly what time yet, but we'll be getting the word out.
Absolutely, you will all be invited to.
So why wouldn't you do it in the Kelly area, somewhere down there close to Black River?
We know when, that's the first place I thought of, but that's certainly an
And
option.
that's the people we need to be listening to.
Yeah. We could schedule it down
Yeah.
Yeah.
Probably looking at it.
there. Yeah. Have it at the fire department, or go to the community building in Kelly.
Churches down
Yeah, that's a good idea. I'll do that.
Great.
And question, I know one of them, do you have enough funds to complete this project?
So we are pretty close to having the funds to complete the project, yes. We did have a little bit of a change in funding, so we're actually looking to bridge that gap. It was about $50,000, so we are looking at that, but we're pretty close to having what we need to complete this portion of the project. What we're really looking at now is how to start the plans for the restoration of the culverts that we determine need that attention. So we've actually started to reach out to grant sources and foundations to look at getting that funding. So that's really our focus at this point.
Most of you have enough to do to get
Correct.
that done also.
Correct.
Thank you.
Motion to approve.
We got a motion by Mr. Peterson, we got a second by Mr. Gooden. Any questions?
Well, I have 6 people.
Yes.
Yeah.
6B. All in favor say aye.
Aye.
Opposed? So moved. Thank y'all so very much.
Thank you. I hope to see you on the 27th.
Thank you. Soil conversation, Dean Marsh, the director, please, sir.
Hey, I want to talk to you about a continuation of our stream debris removal project. This is going to be the lower end of the South River. This goes from Highway 41 down to where it connects to the Black River. Sort of divided that into 2 contracts. We're going to have an upper and a lower. This lower section is what I'm here to talk to you about tonight. The low bid is $128,000. DR Jackson Construction put that low bid in. They are from, that's a local Bladen County company that's out of Carver's Creek. So that's what I want to ask for approval for.
Motion to approve.
Got a motion by Mr. Peterson, got a second by Mr. Bullock. Any questions, any discussion? All in favor say aye.
Aye.
Opposed?
It'll be starting very shortly on that also.
Thank you, Mr. Moore. Health and Human Services Agency, Sheila Raines, disease nurse.
Good evening. Thank you all for having me. I'm the community disease nurse for Bladen County Health Department. And I'm giving out some numbers right now. We do our numbers this time of year and tell you what we're looking at in STDs, what we're looking at in communicable disease. And so most of the top ones right there, I would though we see a lot of different things. Looking at what we're looking at this year, the numbers are about the same as last year for Bladen County. Me, of course, always being our top one. The HIV in the county this year has been 5, and that's including the doctor's offices and the ones that we see through the health department. I wanted to get those numbers, but I just want to focus on one thing this year, if I could. I'll give y'all a chance to look at those. Yes, ma'am. We do that every single day where we're at extensively. I would love to have more time to go out in the community. Right now, there's 2 of us doing that job. We also have a whole lot of other roles, but I would love to have more time to go out in the community. We do that teaching every day extensively to everybody who comes through. I know, that would be great. That would be great, that would be great. Ma'am?
Range, what are we talking about?
Yeah, we're looking, the most that we see as far as the STDs goes from around 16 to 26, 28, but we have those that are 60 and we have those that are 12. We don't like to see the ones that are 12 coming through. That's never a good thing.
Oh, you had said something about going in the community, that's for like educational purposes.
Right. We could do some of that, and we reach out to the doctor's offices, and we go to different physicians, we go to all the physicians, pass out literature that we have from the state, most of that comes to us free, and try to do some education in that way. Like I said, I would love to have some time to be able to go out and do that. Right now, we're limited on staff, so it sort of pulls us in a lot of direction.
As I'm trying to regulate the last, when they came with numbers on last year,
Yes, sir.
these numbers going up, tend to be a little bit high. Are they higher than what they were last year?
When they are, we're kind of glad that we're seeing more because we're treating more. We know that it's out there, and a lot of them are not coming in for treatment. So hopefully that's talking about some of our teaching as far as they go, and bringing more into the clinic and being more open with that so that they feel comfortable coming.
It's a good thing that they're doing it.
Yes, sir. Yes, sir. Yeah. We do give out free condoms at the front of the health department. We ask them to come in for a little bag, and they're always free to everybody. And we encourage them and encourage their friends to partake of
So
that.
you're saying your numbers are going up, I mean, we need to do more education then.
Absolutely.
Are you available on Saturdays?
Sometimes, yeah. Lisa Britt is actually the STD coordinator. She wasn't able to be here tonight, so I know she's been doing some reaching out. I'm actually in TV, and I'm speaking for her tonight, so. Did y'all have any more questions about the numbers? The other numbers, I just want to sort of focus on one thing tonight if I could, because we don't normally talk about it, and that's tuberculosis. And when people hear the word tuberculosis, they're like, that happens in another country, another state. That is not true. Tuberculosis is alive and well. Some of our neighboring counties have a lot that they see. We've had 2 this year, but I want to tell you what that 2, if I could just a minute, tell you what that 2 means. It sounds like it's just a few, and it is, but the work involved in that is incredible. And if y'all will, I'd just like to speak a little bit of what we do when that comes along. I just want to tell you that TB never affects one person. TB affects anybody that person has been in contact with, and for a period of time. And so we look at all those contacts, if we're lucky, and most of the time we get a phone call from the hospital saying they're here, they're very sick, we know they have TB. And so we get that phone call immediately, we start contacting that patient while they're still in the hospital. Getting those contacts for them and start out in the community. Now that could be anywhere in Bladen to out of Bladen, it could be out of the state. We hope it's not out of the state, but that kind of gets complicated. We share sometimes with Robinson or Columbus, things like that, because they're right there on the line. What we do is we start making those contacts. How long were you with this patient? How long were you with these kids? How long were you exposing these people in this community? How long were you in church? How long, think about the social situations everybody goes to on a weekly basis. And so we look at all those, we try to get every one of those in for testing, especially the close contacts. Your county cars are used for more than just transportation. They're actually used for TB skin tests on the back of the trunk of the county car. A lot of these patients do not want to let you in this house. Some for their immigration status, some for other reasons, and they're scared, and they see that Pike County car come up, and they're like, oh, I want to see you, what are you here for? There's a language barrier a lot of the times, although that's not the primary population we see, it's a lot. There's language barrier, and so, like I said, we do a lot of tests out on the car, so that requires the nurse to go out at least twice to do that TB test, sometimes 4 times because they're not there when you go back. And so we try to test them, get those seen. If they're positive, that's another whole role we play. We get them in for chest x-rays, and then we get them in for treatment. They're not necessarily TB disease, but they've been exposed. So we treat those patients for 9 months. We see them every month for 9 months and give them medicine that the state provides. So that's a good thing. We start with the contacts when the patient comes home. Excuse me. They're on respiratory isolation. This means nobody new comes into that house that haven't been in that house before. They cannot leave that house unless it's transportation to the emergency room. I do have contact with EMS so that they kind of know, what's going on in the county. I don't want them getting out there and getting exposed unnecessarily, and some people don't completely understand what they have, even though you teach them in that way. Respiratory isolation can be taken away from a baby, your baby. It can mean all kinds of things, being separated from your children. So we're very strict about that. The state, we follow their guidelines to a T, and they're very detailed. Very strict about that. For like 2 months, these patients are on respiratory isolation. We bring their medicines every day to them. Not the weekends, they allow that in the state. But every day we bring those medications, so a nurse is in that home, and they see that patient, and they know what's going on with that patient. So you've got a good view of that. When the nurses are out there, we also do everything that patient needs. If they need venipunctures, if they need medicine, if they need social work, if they need whatever they need, because you're looking at patients who can't leave the house. Once the tests are cleared and they're allowed to leave the house. Let me check my notes real quick. They're allowed to leave the house. We still see them 3 times a week. So a nurse has got to go out. It's either myself or another nurse who's been trained in respiratory fit with fit testing, so that they can go out to see that patient. So what I wanted to talk about too tonight is just a little bit about the role that everybody plays in that. I made a list, if y'all will bear with me just a minute. We had 2 patients at one time. They were on opposite sides of the county, so we were driving back and forth, and we were glad to see them. But they took 11 people, 11 agencies to see this one patient this year. Took myself, a TB nurse. Additional nurse has to be trained and out there if I'm not there for some reason. It took our lab staff. There was coordination with our director of nursing. Dr. Wells was a tremendous help to us with one patient, amazing help, because that patient couldn't go to the doctor, and the doctor didn't want them there because they're exposing those patients, and we understand, so we kind of become their lifeline, even for food at times. So, the clinic nurses, when we have a lot of contacts, especially with children in a setting, in a school, all those kids come into the health department. And they have to see them, give that test, read it 2 days later. We're following up with letters and begging these parents to bring these kids in once they've had exposure to it. Also other people that come along. Our translators are wonderful, and without them we couldn't do what we do. We had a challenging case this year in which the lady spoke a dialect, and we weren't aware of that until we got out there and the translators started trying to talk to her and her family. And it was very difficult because Spanish and this dialect are very different from each other. So she basically couldn't read or write the Spanish. So we had difficulty, but there's a lot of hand signals that work too. Her primary physician, LabCorp, works with us. The discharging hospital and the planners have a whole lot to do with that. They help us so much, and we're in at least weekly, twice weekly contact with the state TB coordinator. And she's a wonderful help to us. So it takes, when you're looking at the health department, there's so many things that you don't see, that the public doesn't see on a regular basis. I think it's kind of cool to let people know, because when I was in the clinic, in home health, I didn't know what the health department did. I just knew what I did down there, and I think it's that way for most people, but thankfully, out of those 2 people that had active TB, not another person in the community got TB. And it's a blessing that we sit here tonight and none of us have it. So So just a little overview of how many people it takes to make that happen. That's all I have to say, but do y'all have any
I
questions?
got one.
Yes, sir.
With communicable diseases, with measles and smallpox and all those things fall in this category?
They would, that's only numbers for what we've had.
Okay,
And
so,
Bladen.
I was reading all the news,
Yeah.
and then I've been hearing on the news about the
Right.
immunization problems. Some people
Yes.
coming back and they say things that we thought we had eradicated 4 years ago
Absolutely.
are reoccurring back.
Absolutely, I think measles was one of those, and I'm trying to think which town it was in, and I'm on the spot, so I can't think of it, but, yeah, we've seen measles too, and it's kind of scary, and lots of times it's in groups of people who won't vaccinate in their own little communities, and so that's generally where it starts. And, I know the other counties are working very
We
diligently.
having that concern here, that's what I'm saying, is that going on here?
No, sir.
Bladen County?
No, sir,
So you don't have any reports of that kind of
no,
situation?
we would be on that very, very quickly.
I would like to take the time to ask you to please let your coworkers know that we commend y'all for what you do. We realize you go in some unsafe areas when it comes to health issues, and all that you have done is to go back to. And I know that's gonna be a major concern on each and every one of you. So we commend you for what you do, and we're very grateful and thank you for it.
Thank you, we love what we do. Thank y'all.
Thank you so much.
Mr. Raines, I'd like to see you before you leave.
Sir?
I'd like to see you before you
Okay,
leave.
sure.
Revenue Department, Ms. Renee Davis.
Good evening. I have two bids, for tonight, and the first one is an 8-acre parcel that's located off of Natmore Road. It was foreclosed this year by the county of Bladen, and a bid was placed on August 28th for $1,000. But, yeah, Mr. Hines was gonna be here to say that it
We got a motion by Mr. Peterson, second by Mr. Cogdell. Any discussion? All in favor say aye.
Aye.
Opposed?
Okay, and then, the second one is, parcel on Figure 9 Road. Actually, this was a company, and they just sent in the whole check. I guess they knew they were gonna get it, but anyway, but it was foreclosed several years ago, and they made a bid of $20,000.
Much to say.
What we got here?
Yes. Send you notes. We bring it out.
Yeah, it was foreclosed, and then the county, and the investment into the county was $2,900, and they placed the bid for $2,900. And the value's $3,410.
We got a motion by Mr. Peterson.
I say.
We got a second by Mr. Cogdell. Any further discussion? All in favor say aye.
Aye.
Opposed? So moved.
Thank
you. Computer operations. Good evening, sir.
Not too long ago, I did a presentation for some, health department representatives. And I'd like to, I guess, introduce the concept of, personalizing our training for antivirus. We've tried some other training, and what we've seen is a generic, approach to let's be scared of viruses. The way I'd like to do it is to show specifics to our employees and give them the tools to know what to do if something happens, rather than just be scared about things. And this is kind of what I had come up with. This is an actual pictures of some emails that have come through. And this one I wanted to show everybody that as an employee, you're gonna see these things come through. This one actually did get through our mail scanner. And these are the things that I'd like people to pay attention to. Up at the top, and I got close up to it. Up at the top, it had "Dear blank." It wasn't actually addressed to anybody in particular. It's also asking for money in the UK currency. It's in pounds. So that should have led people to, you know, look at it and say, I'm not gonna open this, I'm gonna go ahead and delete it. And that's what we're gonna teach everybody, just don't panic, just get rid of it, move on. This one is the top of that particular, and the close-up shows that even though it came across as looking like it came from Chris Harrelson, the actual email address is coming from Garbage Hotel, if I'm pronouncing that correct. And in the red, I've highlighted, that is the virus itself. That, like I said, that got through our email scanner. That's not our antivirus. If they opened it, our antivirus should have caught it. So this is a different type. It's coming from a UPS rather than we usually see invoices or, you know, response to receipts. But this one was a little different, so I wanted to show this one to them. And it also, the package is different. And this one, the package is a link to an external website. And even though it says it's coming from the UPS, I've highlighted that it's not actually coming from the UPS. UPS is coming from Nobody Beats a Canon deal, whoever they are. And what I did was I hovered over that tracking number. That tracking number is a link to the website that's going to give us the virus. And there's a close-up. So as the people would look at it, you could hover over it without actually clicking on it. And you can see that even though it does have UPS in the text, it's actually going to astrosolar.net. And these are the things, this is why I wanted to show it to the employees as training. It gives them the tools to be confident that you know what you're looking at. And that's about it. We're going to implement that, and I'm hoping to get another program for training on basic computer techniques, of how to manipulate files, things like that.
Is that the one you want us to be appropriate money for? You do the software, to get the software to run on your system?
We've already done
To combat that?
Yes, and what we purchased was Sophos, that's our antivirus. And we've had a HIPAA risk assessment done in the health department this past year. And of all the things that we had to do to fix, all the things that were done right, Sophos actually came up and it was 100% successful, which is amazing.
Do you do a yearly prescribe?
Sorry?
Do you do a yearly prescription on this?
I believe we got a 3-year.
3-year prescription?
That's what the state, I'm just gonna use for the,
And they've been catching viruses.
okay, doing good.
Yeah, we were very close to getting a program called Trend Micro. And Trend Micro was used in Charlotte when they got hit. And Sophos is so far, so good.
Mr. Peter, you might have said, but how are you training the employees? You going around to each department or?
We initially, got a guy in from our,
Risk management
insurance.
Yeah.
And he did a presentation. And what we'd like to do from now on is to have it come from computer operations and be specifically for our employees, things that we see. And like I said, I want it to be not just scared of our emails or scared of viruses. I want our employees to have the tools to know what to do when something happens.
All right, thank you, sir.
Thank you, Ron. County Board appointments, here we go, Fire Service District Committee.
Irving Owens.
Second.
We got a motion by Ms. Peterson, a second by Mr. Bullock. Any questions? All in favor say aye.
Aye.
Opposed? So moved. Industrial Pollution and Control Financing Authority.
I got Paul Evans and Don White.
Second. Got a motion by Mr. Peterson, a second by Mr. Daniel Dallas. Any questions or further discussions? All in favor say aye.
Aye.
Opposed? Kelly Fire Service District.
Motion to reappoint.
And he declined, so,
Yeah, that's right.
so that's the reason, they have not come
Make a
back.
motion to put Bullet Rooks on.
Yeah.
Bullet Rooks.
Good job. Got a motion by Mr. Peterson on Bullet Rooks. Got a second by Ashley Truitt. Any further discussion? All in favor say aye.
Aye.
Opposed? advisory board appointments for consideration during September 17th, 2018 meeting. Keep Blade and Beautiful, 5. Voluntary Agricultural Districts Committee, 2. Watershed Review Board, 3. Keep those in mind and be looking.
Mr. Brett, we really need to spend some time and find some people on that to keep,
Keep Blade Beautiful.
you know, we're struggling to get, we need good people on there, we're struggling to get people to attend the meetings and stuff. And Mrs. Saunders got and leads it, and I don't want her to quit, she does a good job.
We need 2 high schools and
Need one.
what
We got all that. East Blade, we got.
Yeah, one, two,
Did one piece blade?
I just got it.
What's her name? Queen Blade don't have,
No, it's got next month. It's on the 17th.
next month, okay.
County Manager, Mr. Greg Martin.
Thank you, Mr. Chairman. I'd like to review the calendar with you for the months of September and October. It's, tell you, busy months, it looks like. The diabetes forums continue at Baldwin Branch Church on Wednesday evenings, the first and third Wednesdays of the month. On Saturday, the 8th, from 11 until, there is a fundraiser for Dennis Pate. Barbecue plates and the cake auction will be held, and that will be held at Center Road Baptist Church in the Center Road community. The Health and Human Services Advisory Committee meets on Monday the 10th at 5:30 p.m. On Tuesday the 11th at 12 noon, the Elizabethtown White Lake Area Chamber has its monthly luncheon meeting at the Cape Fear Farmers Market. That afternoon at 2 p.m., the opioid working group meeting will be held at the Health Department, and that evening at 6 p.m., the Crowd America service will be held on the courthouse lawn. On Thursday, the 13th at 7 p.m., the Fire Association meeting will be held at the Training Center at White Lake. It's hosted by Clarkton. On Saturday, the 15th, the 26th Annual Dublin Peanut Festival will be held from 10 until 5. The board meets on Monday, the 17th at 6:30. On Wednesday, the 19th, the Diabetes Forum continues. Thursday, the 27th, the MCAB meeting will be held at the Cape Fear Farmers Market at 7 p.m. And on Friday, the 28th, from 10 until 1, there's a car seat checkup event at Cape Fear Farmers Market. Moving over to October, there's a prayer service at 8 a.m. on the 1st. At 6:30 p.m., the board has a regular meeting here. On Wednesday, the 3rd, the Hang 'em Up Day will be held from 11 until 2 at the county park. The Diabetes Forum continues. Also, the Hang 'em Up Day continues on Thursday, the 4th. On Friday, the 5th, from 1 until 8, the Cycle North Carolina event will stop in Elizabethtown or Bladen County, and that will be hosted by the chamber here. There's a Pet Palooza scheduled for Saturday the 6th, and we'll let you know as soon as the time and
This is
location.
Armory, Greg.
It is at Armory, okay. We heard that, I think we just heard today that has been changed now.
Oh, you been changed? Oh, I'm sorry. That's the last word Mike told me.
Yeah, and I remember that, but it,
Okay. Sorry.
the Health and Human Services Advisory Committee meets on Monday the 8th at 5:30. The chamber meeting on Tuesday the 9th at 12 noon. The opioid forum on the 9th at 2. The rain dates for Hang 'em Up will be the 10th and 11th. There is a Seafood and Sunset event that will be held on Thursday the 11th at 6 p.m. and that's a BCC Foundation fundraiser that will be held at White Lake. Also, the Fire Association meeting will be held that evening at the Dublin Fire Department. There's a special meeting of the board on the 15th at 5 p.m. and that will be held at the Ag Services Center that will be a report to the people hosted by the Cooperative Extension Service. The board meets that evening at 6:30. And then on Thursday, the 18th at 6 p.m., I think dinner may start at 7, but it begins between 6 and 7. Lumber River Council of Governments annual dinner held in Lumberton. And then on Friday and Saturday, the 26th and 27th, the annual Bladenboro Beast Fest will be held in Bladenboro.
Greg, the opioid meeting might be moved depending on the ladies from Chapel Hill.
In October.
Yeah.
Right, yes, sir. We'll let them know as soon as we know.
Lake Ministerial, is that the second Tuesday?
Yes, sir.
Second Tuesday in October
Okay.
at 8:30.
First Tuesday,
First
but this year it's the second Tuesday. I mean, this month is the second Tuesday,
Okay.
excuse me. But it's the first Tuesday of every month.
So October, you're right, okay.
Solarium at the hospital.
Okay, thank you.
At 8:30. 8:30 a.m.
Okay, thank you. If there are no other events, Mr. Chairman, if I move to item B. and that is to share, each year this time after the state has adopted its budget for the community college, a full budget comes back to the county commissioners and to the board of trustees for approval. And you have that information with you. The state budget totals $9,944,394. The county budget is $1,381,663. Institutional budget totals $5,135,000 for a grand total of $16,461,057. And the statement, I was thinking generally it says review, but the statement says the attached college budget has been reviewed and approved in the amount of $16,461,057 by the county commissioners. I know you're not asked to change your dollar amount, so, Mr. Chairman, maybe, I know it's not on the agenda, if we could have a motion just to say that the board's seen it, that may be most appropriate.
Motion that we've seen it.
Second.
Got a motion by Mr. Peterson.
I haven't seen it. but that-
Yeah, okay, it's in the, it's in the,
It's in the packet.
It's
should,
in
should be,
I have one. I don't have one.
We got a motion by Mr. Peterson, a second by Mr. Gooden. Any further discussion? All in favor say aye.
Aye.
Opposed? So moved. While we have the chairman of the board of trustees, Mr. Dennis Troy here, I would like to say on behalf of Mr. Troy, and he'd be more than welcome to speak, sir, but I just want y'all to know, after given the opportunity to be on the board of trustees and be able to sit in a couple of meetings thus far, you'll never know how appreciated that the board, the president, and all the folks at BCC, how much they think of the commission and what you've been able to allow them to do. I can't express upon just 2 meetings what I've learned and how they really feel about us. We do a lot, that's allowed them to do a lot of stuff. Mr. Troy, would you like to make a comment?
First of all, Brett, I thank you for making that comment, and I want to thank each commissioner on a personal basis. As I look you in the eye, I want to thank you for the support you give to the college. Because on the national level, it's what can you do to make a student successful? We're dealing with a large number of students coming out of high school now, and you didn't do what you do here as far as funding